The tapeworm's life cycle begins here. Dogs release eggs into the environment. Grazing sheep accidentally ingest them. Humans become accidental hosts too. Larvae then form cysts in vital organs. Once swallowed, the eggs enter the intestine. Here, they hatch. They enter the portal vein, traveling to the liver. Finally, they become trapped in the liver tissue. It begins with a microscopic larva. Slow development creates a fluid-filled cyst. Over years, it expands, compressing tissue. Daughter cysts form inside the main cavity. Most liver cysts are asymptomatic. However, as they grow, they can cause discomfort. This leads to feelings of fullness or pressure. This is due to the size of the cyst. This 3D reconstruction reveals a large hepatic hydatid cyst. On ultrasound, it appears better to find these internal daughter cysts. MRI provides the optimal detail of the cyst structure. The medication travels directly through the bloodstream, reaching the liver. Inside, the treatment targets the rapidly reducing their activity. This effectively neutralizes the infection. This animation depicts a liver affected by a large hydatid cyst. Controlled techniques are used to safely aspirate the contents. This preserves the remaining healthy liver tissue. Following successful treatment, healthy liver tissue gradually expands. Normal blood flow is maintained as the cyst cavity fully heals.
To prevent hydatid disease, treat your dogs regularly. Wash your hands with soap and water. Always wash all your fruits and vegetables, and keep dogs away from livestock.